Awesome. Hi, everyone. My name is Sammy Taylor. I'm one of the InReach coordinators here at HCPF Healthcare Policy and Financing in the OCL Office of Community Living within HCPF. Welcome to our skilled nursing facility social work office hours for December. We can go ahead and move to the next slide. Just some housekeeping things. We are recording this session. If you're ever not able to make it to one of these optional office hours, you can view the recordings on our website along with a copy of the slideshow in case you need it for your records as well. So that will be uploaded on our website. Feel free to always use the chat if you have any questions or raise your hand since this is a smaller group. You can do that anytime during the presentation. If you're listening by phone, press *6 to unmute your line or *9 to raise your hands. Closed captioning is always available by hitting the CC icon at the bottom of your screen. And then also accommodations can be made ahead of time if you email our ADA email here at HCPF, and we will definitely try to get that accommodated for you. And then also please avoid sharing any PHI during this meeting. But let's go ahead and get started. So our agenda today, we will do a quick overview of rapid reintegration because that is starting early 2026. So we're excited for that to finally be able to roll out. So we'll have Sarah go over that. And then I have an update for you guys for individual InReach to go over some of the numbers that we've already hit for this year. And then we have just a few things at the end we wanted to cover. So before Sarah dives into rapid, I just wanted to ask if you guys can, do you guys mind just entering your name, your title, and the agency that you're with into the chat so we can help keep attendance? So again, just your name, your title, and then the agency that you're with. So whether it's a community partner or SNF, just so we can keep attendance, and you can do that throughout the meeting as well. That'd be greatly appreciated. But let's go ahead and dive into Sarah's presentation over rapid reintegration. Sarah, take it away.
Hi, everyone. Thank you. I'm Sarah Geisler. I'm an InReach coordinator here with the Department of Healthcare Policy and Finance. You can go ahead and go to the next slide, please. I just want to give you kind of an overview of rapid reintegration and which is going into effect on January 1st or January 2nd of 2025. Rapid reintegration will support Health First Colorado, Colorado's Medicaid program members by providing the opportunities for individuals to make an educated choice about transitioning to the community sooner. Case managers will educate and provide available resources and information about community living options. This process applies when a member who qualifies for the initial level of care for nursing facility services expresses interest in returning to the community, but currently resides either in the hospital or in the community. Next slide, please. It's going to show a little bit of a flow chart that we have going on. The first part is rapid reintegration process is initiated when an individual expresses interest in returning to the community during the level of care for the nursing facility. There's an additional section called Community Living Education in the CCM. Then the barrier questions will ask if the member is interested in transitioning back to the community, and CCM will then notify the case managers to do one of three things. This will either be to send in a transition escalation ticket if they do not have Medicaid. If they have high risk or barriers, the case managers will then make a referral to the TCA or the Transition Coordination Agency for a rapid referral within 2 days of the level of care. Then the TCA will accept it within 2 days to start that process. Or case managers will need to complete the rapid reintegration plan assessment if there are low barriers. And finally, rapid reintegration will be considered completed once the member resides in the community and the case management agency conducts a post-rapid reintegration satisfaction survey with the member within 90 days of them transitioning back to the community. Or if the member decides to stay in the nursing facility, then the case manager will add information under comments just stating that they decided that they were going to stay. Next slide, please. I just want to go over how nursing facilities can support rapid reintegration. One, by coordinating with the case managers and or with the transition coordination agencies to make sure it's a safe discharge. Also, if needed, obtaining a physician's order for durable medical equipment or home health, conducting discharge planning responsibilities as stated on the operational memo, arrange for durable medical equipment to be established prior to discharge, complete the 5615, initiate process for home maintenance allowance, which a quick reference in a physician statement is now available on the transition website, and we'll add that to the chat here, and also to schedule any post-discharge doctor's appointments. Next slide, please. I'm just going to go over quickly a little bit about home maintenance allowance. I'm sure you guys are familiar with it, but those of you that aren't, home maintenance allowance is based on actual and verified shelter expenses such as mortgage payments, taxes, and utilities. It'll be calculated based on verified expenses, and the result will be communicated with the nursing facilities on the 5615 as a part of the patient payment calculation. Eligibility workers, skilled nursing facility billing staff members, and anyone assisting the members should coordinate as much as possible through any means that are reasonable, like email, fax, etc., in order to secure verifications necessary to calculate the home maintenance allowance. Nursing facilities should consider this program for anyone already in the nursing facility or one that might be in the nursing facility for longer than 30 days and they are interested in returning back to the community within 6 months. We have again created this home maintenance allowance quick reference and also the physician form that needs to be filled out, both of these which need to be filled out, and they are on the Transition Services website. Now, next slide, please. You will see we also put together a rapid reintegration quick reference for nursing facilities and additional resources. The first 2 pages are here, but there are a total of 4 pages. Also, there was an email blast that we sent out about, I think it was last week, about the new resource. If you did not receive this, please put your information in the chat so we can make sure that we have your information to communicate other upcoming information that might be valuable to you. Next slide, please. We also have additional resources in regards to rapid reintegration besides the quick reference. With additional resources for nursing facilities. You can find the nursing facility diversion project page. You can also review the operational memo. It will help understand the process for rapid reintegration. Then we also have the InReach team project feedback form, which is available to provide feedback, ask questions, and report any issues or concerns you might have. And then the final one is our contact information. Currently, I am the one heading or leading rapid reintegration. We also have Victoria Lewis, which will be taking it over after January. And then we have our main HCPF InReach box, which you can see HCPF _ CLO _ InReach at state.co.us. And then I'll go ahead and open it up for questions. And then I can also add in some of those websites if you guys have any questions or those links. Any questions? If not, I'll turn it back over to Sammy.
Perfect. And I'm just looking over the chat and I don't see anything, but if anyone has questions, feel free to ask even when I'm presenting about individual. I know Sarah will hang on, but thanks, Sarah. I appreciate you going over all this. Awesome. So we can go ahead and do a quick update on individual InReach. So I am the InReach coordinator on Sarah's team, but I am the program lead for individual InReach. So we do have some updates. So officially, individual InReach did kick off July of 2025, where we did have a slower onboarding month. And that was mainly because agencies were falling into place with getting used to the new contract and then also getting up and running with the new system that we were using. But you can see that there was definitely an increase in the residents that were outreach through individual inReach who completed that education with their inReach counselor. So we had 36 in July, August 111 members, September 116, and then we had a huge jump in October. And I will say that is correlated with two of our regions really making sure that they got their numbers in and were able to outreach residents before the snowfall, which we ended up having a delay in snowfall, but they were just being really proactive, which is great. And then in November, it did go back down, but overall, it's still increasing with 151 members receiving individual inReach in skilled nursing facilities. So I do anticipate those numbers to steadily increase over the next few months, with December being the exception, because I know with the holidays, a lot of people are taking time off. So I would expect to see a slight decrease for December, but I did want to just throw out that the average opt-in rate is around 53%, and that has been pretty steady over the past few months. So about half of the people who are offered this education on Medicaid benefits, including community transitions, about half of them are opting in to receive that education. And then about half of them are declining that resource, which is perfectly fine. And then I did want to create a quick slide over TCA referrals. So we can see similar trends with TCA referrals. So you can see an increase and then definitely a jump in October. And then it did settle back down for November. So we have a slightly higher conversion rate for TCA referrals from referrals for transition coordination agencies. So about 62% of the people who receive individual inReach do subsequently ask for a referral to be sent over to a transition coordination agency to start that transition process. And I do like to highlight that residents who want a referral sent, they can opt out at any time. No transition is ever a guarantee. If they want to just start the process to see what it's like, either before or actually after the transition is completed, they can still decide to opt out. So a transition coordination agency will follow the member up to 362 days post discharge from the skilled nursing facility. And at any time, if the member decides that they no longer want to transition into the community, the transition coordination agency can help them move back into the facility. So we're excited to see this increase in TCA referrals. And then our next slide. So just wanted to highlight, most of you at the skilled nursing facilities are probably already up to date with our opt-out verification process, but per the Department of Justice voluntary settlement agreement that Colorado is currently under, our escalations team at the department has to verify every single individual inReach opt-out. So we have to verify that the member does in fact not want to receive that education on community transitions and other Medicaid benefits. So what we are doing is anytime someone does opt out, we submit a ticket through our escalations process that we'll cover at the end of this meeting. And then our escalation team does have to verify. So first, they will reach out to the skilled nursing facility to verify if someone does have a legal guardian. If someone does have a legal guardian, then we will go ahead and contact that legal guardian directly to verify that they did want to opt the member out. If someone does not have a legal guardian, then we would contact the member directly. So we'll work directly with social services directors or other SNF staff to see what the best way to go about contacting the member is. So the resident can always just sign an individual inReach opt-out form if that's easiest for them. If they can't sign, if they don't have that capability for whatever reason, we can have two collateral contacts verify. So like the inReach counselor in the SSD, for example, they can sign on behalf of the member, just letting the escalation team know that the member wasn't able to sign physically, or they can put their mark if that's how the member signs their forms. If not, we can do verbal verification with the member, whether that's contacting the member directly over the phone by calling if they have a cell phone or a room phone in their room. And then also the SSD can help us with any other verification needed. So we just wanted to mention that. And I just wanted to pause real quick just to see if there's any questions on the opt-out process. Awesome. I don't see anything in the chat and I'm not hearing anything, so I'm gonna go ahead and move on. So I know Sarah will be covering a lot of those opt-outs along with another person from our team. Her name is Angel, so you will probably be hearing from both of them as they get going on working with those. And then we'll go ahead and move over. So our regions, so in the state of Colorado, we have a total of 14 regions, and we have our active regions, and those regions are active via contracts and then various purchase orders. But then we have our separate regions where there's an active RFP process being engaged. I was really hoping that I'd be able to announce the results of that RFP process, but we're in the very final stretch of that process. So in the coming days, actually, hopefully by next week, we'll be able to officially announce the results of the RFP process for those regions. So I'm going to leave you guys on a cliffhanger for next month. Please attend next month's meeting and we will have an update on that. But hopefully in the next coming days, we'll be able to release that information for those 5 counties: Region 1, 2B, Weld County, 3B, Boulder, the El Paso County region, Region 4, and then also down south, the Alamosa area. Awesome. Any questions on any of that? I'm going to check the chat real fast. And I know this month we had a lighter meeting, mainly because it is the end of the calendar year. So I know people are finishing up with a few things. Okay, perfect. So the only other thing we wanted to cover for this month is I did want to go over our escalation process. So I know Sarah talked about it, and then I also mentioned it in my presentation over Individual InReach. So this escalation form link, thank you, Sarah. She just dropped it in the chat. The overall process isn't new, but we did just add our programs into the escalation process. So anything related to community transitions, InReach, rapid reintegration, or anything tied to the DOJ settlement agreement is now part of this. So use this link for anything Medicaid related. The purpose of this link is so applicants and members and natural supports or community partners of Health First Colorado and the CHP Plus, Child Health Plan Plus can use this web form to submit an escalation or complaint. And I also like to mention if you have a question about something as well, submit this escalation, because what will happen is every single escalation that's entered goes to a team, and that team is dedicated to making sure it's routed to the appropriate party who can best answer your question. So then you don't have to keep track of who does what at HCPF, because there is a lot of us. So it's our internal phone process, our phone tree, where we make sure it's mitigated that way. And then we'll have the appropriate person reach out to you and or look into the situation. So if you have any complaints, concerns, or questions regarding anything Medicaid related, that could be specifically about the county office, the Department of Human Services or Social Services, any eligibility site, any case management agency, local contact agency, also known as InReach Counselor, TCA, Transition Coordination Agency. Even if you have a question on Medicaid claims, redeterminations, anything like that, or upcoming changes to the Medicaid system, please feel free to submit that escalation link, and then we will have someone within HCPF assigned within 24 hours, 24 business hours, and then we'll reach out to you if needed. Any other questions on that? Awesome. You guys are a really easy group today. All right. And then we have our contact information. So Susie and I are the coordinators over InReach, and then we have our director, Jill, who is the Compliance and Innovation Division Director, Matt Bohannon, who is the Access Unit Supervisor over the TCAs, and then we have our different InReach and escalations emails, if that is easier for you guys. One quick thing I like to mention is if you email that bottom email, the HCPF_TCM_TC_escalations, it'll actually automatically submit an escalation ticket for you. So that is a time saver. So feel free to do that as well. And then you can always contact us if you have questions or any concerns or just need more resources. Because I know as we roll out these programs with individual InReach, group InReach, and then now Rapid, which we're excited about, a lot of questions will come up, especially when we start doing the work. So don't hesitate to reach out. We definitely appreciate questions, but that was all that I had for you guys today. So I will hang on the line in case you guys have any questions that you didn't want to ask in front of the group. But like always, hope you guys have a good afternoon. Happy holidays if you do celebrate. And then, yeah, feel free to stick around if you had any questions. I'll still monitor the chat. But have a good one, guys. Thank you for coming.